Welcome everyone to our webinar, Working Together to Put Fall Prevention on the Health System Agenda, a position paper for Ontario, facilitated by the Ontario Neurotrauma Foundation. My name is Mariel Ang, and I am a project coordinator at ONF. I will be assisting with the webinar technology today. To start, I will give you a rundown on the Zoom meeting platform. And please bear with me for a second as I share my screen. Your screen may look a bit different depending on the type of computer you are using. If your Zoom application opened in full screen, you can double-click or press the Escape button on your keyboard to exit the full screen. There should also be a button on the top right corner of your screen that says Exit Full Screen. On this slide, you'll see that I've circled it in red. The webinar technology consists of two parts, audio and visual. Both visuals and audio are provided through your computer monitor and speakers. To test or adjust your audio settings, look for the Audio Settings or Join Audio button in the bottom left corner of your screen. This will provide options for testing your computer microphone and speakers. If you look at the bottom center of your screen, you'll see buttons that allow you to access the chat box, raise hand, and Q&A features on Zoom. The chat box allows you to send messages to the webinar presenters. You will only be able to see chats that are sent by the panelists. You can use the raise hand button if you want me to connect with you through the chat box. Please submit questions to the Q&A box. You will be able to see questions asked by all webinar participants. If you need to leave the webinar at any time, click the red Leave Meeting button in the bottom right corner of your screen. If you have questions about the technology at any time during this presentation, please type them into the chat box or use the Q&A feature on the Zoom software. Alternatively, you can email me at mariel@onf.org. I will work with you to resolve technical issues as soon as possible. And I'll be putting my email in the chat box so that you can easily access it shortly. Please note that the webinar is being recorded and a YouTube link will be sent to all participants along with the presentation slides after the webinar. I will now pass it along to Hélène Gagné, who will be facilitating the webinar. And Chris, you are welcome to share your screen once again.
Bye.
Thank you, Mariel, and welcome everybody. I'm Hélène Gagné with the Ontario Neurotrauma Foundation. I'm the program director. I'll be facilitating the question period. And before I introduce our speakers today, I'd like to run a little poll to find out who's online, a little bit more about you. So maybe we can go with the first question, Mariel. Please tell us what region you're from. And you may have to scroll down a little bit to see if your region is not represented or if you're out of province. If you want to start answering the poll. I'll give you a few more seconds. Some people cannot see the poll. So yes, if you cannot see the poll, you can let us know in the chat box. So I see people from Thunder Bay, Northwest Lynn, Grey Bruce. So maybe we can end the poll and I'll read Simcoe, Oxford, Windsor. Some people hear music. Oh, that's a problem. That's Thorani. So maybe Mariel, you can connect with Thorani. And Norfolk, more Windsor. So we'll end the poll. And we can see the results, Mariel. Here we go. So we have quite a bit of a representation. Did people answer the sector question as well? We did. We had multiple choices. So quite a few from public health, community healthcare. We have also research and evaluation, rehab. So we have quite a bit of representation and other. Thank you, people. That was good to know who was on the line. Thank you very much. And I still see people coming in and from Hamilton, Toronto. And some people said that the poll showed up on a separate window in a browser. So good to know as well. Thank you for your responses. And now I'll introduce you to our speakers. I'd like to introduce you to Christine Bidmead. Christine is a project manager with the Regional Geriatric Program of Eastern Ontario. And our second speaker is Susan Bonomo. Susan is a public health nurse with the York Region Public Health. And Susan's also the co-chair of LOOP, the Fall Prevention Community of Practice. I will leave it, I think Chris is the first to start.
I am. Hopefully you can all hear me. Thank you, Hélène. And so I would just like to give you an overview of what we're presenting today. So the next hour's webinar will touch on the background, the Ontario Fall Prevention Collaborative, the discussion of the identified priorities of the collaborative, the position paper, and a general discussion about the way forward. So one of the first things is to, when we talk about a fall, is to identify a definition, a common definition of a fall. And according to the World Health Organization, this is the definition that is that they recommend, and it is one that is used consistently across a lot of agencies. So please consider promoting and using this definition of a fall in your efforts to prevent falls, to ensure that we're all on the same page when it comes to a definition. So this information will not be new to most of you, but it's very useful information when you're discussing the importance of fall prevention and the impact it can have on injury prevention and quality of life for older adults, as well as costs to the system in terms of savings and hallway medicine, ALC, etc. This information is available in the position paper and to highlight the importance and the breadth of this issue. So fall prevention in older adults encompasses a range of strategies, and it includes a number of components. We know that multifactorial interventions that are tailored to counteract falls risk factors that are identified through an individual assessment and tailor-made for that, around that assessment, are the most consistently effective among various settings. So there are various levels of prevention. There's primary prevention, secondary prevention, and tertiary prevention. And prevention at all stages of the senior's journey of risk, from healthy older adult to frail, is a key component of any fall program and fits with ensuring that timely screening, assessment, diagnosis, and intervention take place across all sectors of healthcare. So in 2011, the province of Ontario released the Provincial Integrated Fall Prevention Framework and Toolkit. And by 2015, it was becoming clear that there was no provincial oversight to tie the regional initiatives together to bring any cohesive change across Ontario. Some fall prevention leads got together to discuss this issue, and in 2017, supported by the Ontario Neurotrauma Foundation, we met and started to organize a collaborative. In November 2018, so just last year, we held a think tank in Toronto, which comprised of representatives from key organizations involved in the planning and implementation of fall prevention interventions in Ontario. These included local health integration networks, public health units, non-governmental organizations, professional associations, regional geriatric centers and programs, and clinical teams. The November think tank meeting was very successful. Sorry, I need to advance the slide. And it helped create a pathway forward, which was very timely given the changes in healthcare landscape in Ontario. We developed a mission and some priorities and some work on position papers to inform and influence policy. There was an environmental scan that had been commissioned by the ONF, which focused the group in identifying the following priorities for fall prevention in the province. Provincial oversight was one, with a system approach to support agencies and sectors. We really felt that this was an important part, and this was the part that was missing from the the 2011 provincial framework. Common data measurement. Having a common framework for data measurement was also very important, making sure that the data was going to be relevant to what we wanted to learn. Knowledge exchange and resources for standardized fall prevention screening and assessment tools and for interventions, and then developing position papers to inform and influence policy during this time of change. And it certainly is a time of change. So the purpose of the position paper was to guide a more integrated and coordinated and efficient approach to fall prevention. And in April 2019, the collaborative submitted a position paper tailored to the priorities of the previous Council for Ending Hallway Medicine. And Hélène will put a link to this, as we heard today that the Council have released their report and we are actually mentioned, which is very nice. So a later version of the position paper has been expanded to ensure that fall prevention is embedded into the establishment of Ontario health teams and other system changes in the Ontario healthcare landscape. It also highlights that fall prevention evidence shows that there is a return on investment. This is an opportunity not to be missed. At the moment, we have a very fragmented system of delivery for fall prevention across Ontario, each region doing really what they can where they are, and we haven't really been able to find out what programs are working, how programs can be improved, and where greater investment might be useful. We really need to think and work differently. And one way of doing that is the integration of fall prevention into system planning and service delivery models. And this is where I'll hand over to my colleague Susan, who is going to talk about some ways forward. I think, Susan, you now need to share your screen. Yeah.
Okay, thank you very much, Christine. And I think you can see my screen now. And so just to continue on, the ultimate goal of integration is to ensure that health providers from across the province, from across the continuum of care, work together to deliver complementary coordinated services, both within and outside of the health sector, and that they contribute to improved health, sorry, I've got a cold and my language isn't coming across very clearly, to improve health outcomes from a holistic, patient-centered perspective. Okay, so an integrated system approach to fall prevention includes from a healthy to a frail older adult, from community to long-term care settings, across sectors and disciplines to produce a more efficient and effective holistic approach. The rationale for such an approach includes reducing levels of siloing, duplication, and fragmentation, offers a more holistic approach that better addresses the multiple intrinsic and extrinsic causes of a fall, and the often complex needs of older adults. And it's also been shown to reduce the rate of falls by up to 24%. Such a holistic approach exists within the Queensland Stay on Your Feet framework, which has been adopted and adapted by some LHINs in the province already, with the permission of Australia. The Stay on Your Feet model is designed to reflect the movement of an older adult across different settings of community, hospital, and residential aged care. Where the person is located along the continuum is dependent upon their health status and falls risk. This pictorial describes the need for different and similar levels of prevention, screening, assessment, and intervention across the journey of risk. As Chris mentioned earlier, in 2011, the Provincial Integrated Fall Prevention Framework was released. And here we show a version that's been adapted by the Ontario Fall Prevention Collaborative. In this slide, we've highlighted the provincial oversight and its functions at a systems level. In this version, the change is moving from a program-based approach towards a system-based approach to fall prevention in Ontario. This recognizes the need to focus on common functions such as knowledge sharing, standardized provincial performance measurement, and alignment with provincial and national organizations and initiatives. So the recommendations for an integrated systems approach include a minimum provincial standard for fall prevention through an effective integrated fall prevention program in each region of Ontario. Having relevant fall prevention standards across the province should allow for local needs to be reflected in the delivery and evaluation of regional initiatives. At present, for example, we all know that the data is collected and reported on relates to falls visits to the emergency department. However, in rural Ontario, the emergency department is not only the walk-in clinic, the urgent care clinic, but the after-hour clinic as well. So it's capturing more data than actually in other areas. The next, and you can see in this particular slide, we're highlighting the provincial systems-based approach on that right-hand side. The second recommendation is provincial oversight of key centralized functions for an effective fall prevention system. Common planning and implementation of fall prevention at a systems level, including functions that should be shared provincially, such as measurement, communication, knowledge exchange, consistent training, standardizations of assessments and interventions. A good example of this is the exercise programs that are funded by the ministry. And again, just highlighting that right-hand side. The third recommendation is that fall prevention is a mandatory priority for Ontario health teams that are being developed currently that serve older adults in particular. The fourth recommendation is the provision of fall prevention supports and enablers for Ontario health teams that serve older adults. And again, the fifth recommendation is continued support for the fall prevention initiatives that are conducted by Ontario's regional public health authorities. These three key messages found in the position paper reinforce the impact of falls, the present issue with fall prevention efforts, and recommended actions. The first key message is that fall-related injuries are a leading cause of emergency room visits, hospitalizations, and long-term care admissions among older adults, and all of which contribute to overcrowding and hallway medicine. Unless we address this, we may not end those. The second is that a large body of evidence indicates that fall prevention programs and services can contribute to significant reductions in fall-related injuries, hospitalizations, and associated healthcare costs among older adults in Ontario. However, the collective impact of fall prevention efforts in Ontario is limited by a fragmented system of delivery that makes it difficult to maximize impact and efficiencies. And the third key message is that an integrated system approach to fall prevention with an appropriate level of provincial oversight will be more efficient and cost-effective approach that can be expected to yield positive health outcomes among older adults. At this point, I'd like to hand it over to Hélène to continue the conversation.
Great. Thank you, both Chris and Susan. Before we start the conversation, as you see, we left a fair bit of time to have a discussion. But first, I want to know if people have questions on the presentation, the paper per se. We will provide a link to the paper, as well as the slides and the recording after the webinar. So you will have access to the paper per se. So we just provided an overview. So any questions on that piece right now? Okay, I don't see any. So maybe we can start the conversation. If we can put the slide back on for the discussion. For whatever reason, I don't see it. Did it go away?
Mhm.
I can reshare.
Yeah, that'd be great.
I'll reshare. Sorry, I can do that.
Thank you, Susan. Great, perfect. Thank you. You might have.
I advance the slides for you too, Helene.
Oh, that would be awesome. Thank you.
Okay.
So the purpose of the discussion, as you know, so this is work that's been done for close to 2 years now, and we want to make sure that we are working together to have an integrated approach to fall prevention. And we have identified some pieces of the work, as you heard from Susan and Chris, and we have provided those papers, but we certainly want to know what else can be done. But let's start with the first question that has to do with the integrated approach to fall prevention. So what do you think of the collaborative's recommendation for an integrated approach to fall prevention in Ontario? You could look at those words. You can let us know in the chat box. You can ask questions as well. So we would like to hear from you if these recommendations seems to be the right ones, and if there are other recommendations that you would see that should be added. Mariel, do you think it's possible that people can unmute themselves individually, or is that a technical nightmare?
If you would like to speak on the line, you can click the raise hand button and I can selectively unmute you.
Great, thank you. So we hear from Judy that about time, and yes, please, we need to do this. Perfect, it's good to know that we're on the right path. Do you see other recommendations that may have been missed? We know that the Ontario Health Teams is still an unknown component at this point. I would like to see falls as a required indicator in Ontario's quality standards for hospitals. That's a good one. There's a subgroup that's working on indicators and data measurement, as we mentioned earlier. They just started, and we'll give a bit of an update onto their work, but that's a big part of what they're looking at in terms of what are the current indicators and what should be. So we're starting with what is right now, but what should be the indicators moving forward. We have a question from Nandini. Could you share the recommendations on the slide again? They seem to be very comprehensive. Do we have them on one slide? We may not have them on one slide. Maybe I'll ask Susan to read them over, or Chris. So if we can do a quick rundown. Yes, Chris?
Yes, I realized I was on mute, which makes it difficult. So the first recommendation was that we would have minimum provincial standards for fall prevention through an effective integrated fall prevention program in each region of Ontario. The second recommendation was that we would have provincial oversight of key centralized functions for an effective fall prevention system, thinking system-wise. Recommendation number 3, that fall prevention is a mandatory priority for Ontario Health Teams serving older adults. Absolutely key, I think. Number 4 was that the provision of fall prevention supports and enablers for Ontario Health Teams serving older adults. And the 5th one was continued support for the fall prevention initiatives conducted by Ontario's regional public health authorities.
Great, thank you. Christine mentioned that you should also have an initiative for funding to be able to run the programs. Thank you. So funding is to be taken into account. Would someone like to mention the collaboration with the family health teams and the physicians? Can someone speak to that? We know it's occurring in Northeast, I believe. Is it occurring in Champlain as well, Chris?
So we do have, we are involved with some primary care organizations, and we do have a primary care physician at our steering committee, but it's really it's always difficult if you talk to one particular organization. It's very hard to share, but we're working on that. And I think with the collaborative, we do have some primary care physicians at the table of the collaborative, and we also do have a primary care representative at our data on our data working group.
Thank you. There's a question: is there an anticipation that current programs may no longer continue in this plan to integrate the system? I may venture with that, Chris, unless you want to.
No, you go ahead.
I think that integration may require a review of some programs, not necessarily to discontinue some programs, but maybe look at efficiencies and see how they fit in the system. So I think that would be part of having that oversight group that would definitely seek the input of the regions, whatever the regions are at that time. So it may depend on the programs and on their functions and on their connection to the system. There's a comment: there is a senior-friendly care provincial leads committee also making recommendation around Ontario health teams and requirements for care of frail older adults. Would be great to join forces as the messaging is similar. Thank you, Helen. That's definitely, we should be chatting with them for sure. Our LINs and VON have a great programs in strength and balance, but we still work in silos. Yes, that's a good example. And Chris, maybe you can speak to that from the Champlain perspective and what you did about the strength and balance and exercise program.
So we in our LIN had, again, with the changes that happened in 2013 with the physio reform, and the funding of exercise classes, we found that after a couple of years that we had different models of exercise programs and fall prevention programs that weren't the same across our region. Our region, Champlain, for those that you don't know, stretches from Cornwall all along the Ottawa River up to Deep River and across to Barry's Bay and south to Winchester. It's a very large area, and it covers the urban area of Ottawa, but also the very, very rural areas of northern Renfrew County. So we had different models that suited different systems, but we also had different standards of training for our exercise class instructors, etc. So we got together with people from public health, from people who provided the classes, and we looked at what those standards should be, and we did agree that we would have a minimum standard of training for our instructors and some minimum content for our fall prevention classes, just so that somebody, a senior in Deep River, could expect the same standard of delivery. Not necessarily the same delivery, but the same standard as somebody in Ottawa, and all stations in between.
Great, thank you, Chris. And I think that's a good example of that, an issue that could be looked at the provincial level oversight. So that would be a good topic to consider. I have a comment here, which is a good one, is from Karen. Is this able to be collaborative with other existing non-healthcare entities? I'm thinking of a linkage with age-friendly programs that many towns and cities are working on. Definitely would be the answer. The question is how to do it, and I think we certainly need to expand the discussion. As you may have noticed, the position paper, the first one to the Premier's Council, had a very much health focus as it was addressing hallway medicine, and we certainly have expanded the spectrum in the second version of the position paper, whereby we do talk about all the levels of prevention, including health promotion, that would have to be considered to attend to the whole continuum of falls across the lifespan, across the well to the ill older adult. There's a question, can you speak to some specific changes at the provider level that I could take back to attempt to implement in the Champlain-Lynn acute hospitals?
So I can answer to that. Danielle, one of the changes we made was with the emergency departments and outpatient departments in hospitals. And it was more about promoting the staying independent checklist and emergency departments. I think there are 10 hospitals now, and I think the More 4 is one of them. Yeah, in fact, I'm sure they are, who now have a poster, with information about fall prevention, sending out the Champlain Stay on Your Feet message, and recommending the use of the Staying Independent checklist and what to do. And that is across, as I said, 10 hospitals now and growing. But if you look on the www.stopfalls.ca website, you will find all the Champlain tools and information on that website, which is actually about to undergo some changes to make it more user-friendly, but you should find the information there. I can type that in. I'll type that into the chat room.
In the chat room, thank you. There is a comment from Karen. Programs like the YMCA, YWCA are entering into agreements with an increasing number of small towns, so the offering of programs such as Tai Chi and yoga would be helpful. That's good to know. Thank you so much for sharing. As you know, we will be keeping the chat box content, and we'll find a way to share that as well. There's a comment from Sarah. All our fall prevention assessments and interventions are Lynn funded. So wondering what is going to happen. Public health does not manage any of these programs. Anybody got an answer for that one? I think we're pretty much everybody wondering. And I think that's definitely the intent of this work, is to connect all those dots. Even though there are some changes in the environment at the moment, we want to be able to discuss fall prevention at a system level and from a various sector level and the continuum of care as well. Comment, great recommendations, and totally agree about limitations by fragmented system. I'm wondering about specific recommendations, assessment tools in various practice setting, acute versus community, and fall prevention programs. I know that this may be on the agenda with HQO and RCA as well. How are these agencies working together? I certainly can say that the idea of the provincial oversight, we certainly, the RCA is sitting on the collaborative, so we are aware of what's going on, and they are contributing to this discussion and agenda. And certainly HQO, we're looking for a representative from HQO as well. So we are aware that those are critical partners to be working with, and they are part of the collaborative. A comment from Karen, we just had an age-friendly seniors fair. Our falls group was right at the front talking about medications and doing balance testing. It was a huge success. We had the staying independent checklist too at the fair. I am from Sarnia. We have a great local Sarnia group. Congratulations, that will be good to know as well. Question from Christine, are you trying to stick with one program across Ontario? If I can answer that, and maybe Susan and Chris can add, we are not focusing on programs. What we're looking at is a system, and the system will look into what are the main functions that we have to do provincially. For instance, are we measuring the same thing? What's the level of knowledge to share? What are the tools, falls and screening assessment tools that are working under which condition and things like that. As for programs, it may be relevant to some areas. Some programs may be more relevant to than others to some areas. And so we focus more on the system piece. There might be some programs whereby a provincial oversight would be needed. For instance, we heard about the exercise programs that we don't know how they operate in various regions and if they have the same way of doing things. So that might be a discussion at the provincial oversight. but that would not be somewhat, it would probably provide recommendations on how to implement the program and in which program to do, but it would not it would not mandate a program. It would certainly have some suggestions. Do you agree, Chris and Susan?
Yeah, I would agree, because it's very difficult to mandate that you have one program that would work in downtown Toronto and would work in Red Lake, Northwest Ontario. But you would want to know that the program in Northwest Ontario had the similar standard that would be in downtown Toronto. I think that's more what we're looking at. So it's a system. Think rather than thou shalt do this, you need to incorporate these standards into a delivery model that works for you.
And I would agree with that as well. I think it's sort of the same as age-friendly communities, as that there can be like an overarching framework, but it's still going to be based on local need, what you actually deliver on the ground in your area. But definitely having standardization provincially, I think, is very important.
Great. There is a question. Will the standardized measurement be based mostly on number of falls in a region, or will you look at outcome measurement in the programs, i.e. tug, bird balance, walk test? Maybe, Chris, you could take a step at that one.
Yeah, I'll try. At the moment, what we're looking at is the fact that provincially, what is reported is the falls visits to emerge and hospitalizations. And as Susan said in her slide, that's not necessarily a relevant measurement for all areas in Ontario. So we want to look at that and what is being, at the moment I'm going to be saying this later, but at the moment we're looking at what is being collected by whom and how, and what it's being used for, because there are a lot of falls that present to primary care, to walk-in clinics, etc., that are not part of this measurement tool because it's only looking at emerge. So we need to look at that as a provincial measurement. What is the most, and maybe it's something like, injuries, serious injuries, because that's what actually has an effect on the older adult themselves, on the care the required for that patient, and also for in terms of system costs and long-term care occupancy, etc., ALC, etc., etc. But I don't think that we're going to look at outcome measures per se at the moment. I think we're focusing on more of the system, the bigger piece. It may be that when we look at assessment tools and the knowledge part of what tools might be best from an assessment point of view, that we do look at making, for example, one of the things we did in Champlain was we have recommended that the tug or the chair stand test is used as part of the continuum, so that a tug can be done, let's say, in a primary care setting and referred to a community physio who can do a tug as well, or the chair stand or whatever. But if that community physio might want to do the Berg balance, that's not something that everybody is going to be able to do. So we tried to limit it to, okay, you do the tug or the chair stand, and then whatever else you feel you need to do clinically is actually up to you. So I think that's down the road. I don't think we're anywhere near considering that bit yet. I think we're looking at a system measurement at the moment.
Thank you, Chris. Some people I've seen in the chat box are making comments that they can't see all the comments and the sites, the links that have been posted. So we will make sure that the content of the chat box will be shared. We'll probably clean up a bit, but will be summarized afterwards. And I think that Mariel has gone and shared with the attendees the links, like from Champlain and the paper, I believe, right, Mariel?
Yes, and for all participants, if you want your message to be seen by everybody, under the to field, you can select all panelists and attendees. So far, I think all participants, or most participants, have only been sending the messages to the panelists.
Yeah. Great. So please make sure that you center everybody so you can see as I read the comment. I do have a question. What physical tests are we currently using to determine if someone is at risk for fall? So there are quite a few, and that's the reason why we have a screening and assessment tool working group, because we want to take a state of affairs of what is that's being used at the moment and what are the characteristics under which condition. And on that basis, what we hope to do once we have that initial product is to go back to all of you and to members on Loop and ask the question of, is this helpful? Are there other questions you need to know? Is it questions of implementation? It might be one thing to identify the tool, but do most people know how to implement the tool? And so, but at the moment we are looking at what they are, and there are many of them, and there isn't only one tool. But so we're trying to determine which tool are being used under what circumstances and what are the ones that were validated as opposed to those who are not. Is that about right, Chris?
Yeah.
Okay, there's a comment here. Exercise and fall prevention programs in Central West are centralized through the LIN, and this model has worked extremely well in equitable enrollment into programming, gathering outcome measures, patient satisfaction, and fall prevention education. The program components are also standardized, and the participant can expect the same components in education regardless of the subregion in which they are attending a program. Happy to share our model across the province. We will certainly knock at your door. Thank you for sharing that. Yes. We will be calling you.
Yeah.
Thank you, Melanie. So that's why we had the chat box, so we can keep track of those wonderful gems. Thank you. Have you considered a centralized referral process, similar to how patients can refer themselves to home care through the LIN? One of the biggest issues is knowing about the programs and also how to get to those programs. Chris, Susan, do you have an idea? We haven't, I can't say that we've looked in those level of details at the moment, but that sounds like a good idea.
We haven't, but again, when we look at a system approach, it certainly makes sense, because otherwise you get what we call the shotgun approach, right? So 6 different referrals to 6 different agencies, and nobody knows who's doing what. So that certainly it has worked in other services, so why, or areas, so why not? Mm-hmm. Worth consideration.
Yeah, I don't know enough about it to really comment.
I mean, those are all good questions, and I think those would be wonderful questions for the provincial oversight group, which now at the moment, because the health system is in such a flux, our initial intent was to have somewhat of a steering committee, but we figured that it would be better to have this kind of approach, to have a collaborative, and we certainly will be inviting you to provide comment as we go forward and submit to you information that might be of interest or input that you can provide. But we have not considered all these details yet, because we wanted to hear from you whether this work should be a thing that we should be doing moving forward. And we're getting great questions and great input. Another good question here is, what kind of a platform can be used to make sure standards are met across Ontario? Online system, meetings, or webinars such as this one? The reason I ask is because I'm currently trying to update practice guidelines for post-fall resulting brain injury in long-term care homes, and I have no reference point as to standards being regulated in Ontario. I am mostly falling back on current research backed by evidence. Again, wonderful question that would definitely need a provincial oversight answer, and which we hope to be able to do moving forward. Would you vet Loop as a good online platform community for falls reduction? Well, you're asking the right person. Susan, would you like to answer that one, being the co-chair of it?
Can you repeat the question one more time?
Would you vet Loop as a good online platform community for falls reduction?
Oh, okay, absolutely, yes, I would. And if you aren't already a member, then I certainly encourage you to become a member. There are a lot of services that Loop provides, including having a platform for conversation between participants who can pose questions. You can create private work groups on the site. There's access to a knowledge broker. There's access to the webinars such as today. And all of that information related to the webinars and bi-weekly newsletters that goes out is housed on the site. So definitely a great place to have a conversation, ask the questions, and get the answers that you need.
Great. There are many good comments being made right now and regarding fidelity assessment and tracking extent to which standards are being met. But it requires resources to do that. And someone mentioned many tools assess balance are not validated for fall risk. I think we all agree. Funding to continue exercise programs is a priority. So I think that those are all comments, and we will be sending them along with the presentation. But at this point, I was wondering if we could focus on question 3, keeping in mind the time. So from our standpoint, the collaborative, we've done the position papers as were suggested by the think tank. We certainly would like you, all people attending here today, to share the position paper among your networks and your colleagues and let us know about it, because we want to know how many people have seen it. But now we also want to know, other than the data measurement working group and the fall and screening assessment tools working group, what else should we be doing? What are the next steps for the collaborative to promote an integrated approach to fall prevention in Ontario? What would you suggest? And you can put your comment in the chat box.
It's Chris, and I
Yep.
think we really want some help or suggestions as to how we can take that position paper to influential tables and influential people, so that it is woven into, for example, the setting up of Ontario health teams, etc. So any suggestions around that would be good.
Reach outside of silos and see what partnerships and collaborations are available is one suggestion. Is there a way perhaps that we create mini videos that showcase the information but also calls to action? It is important that we do more than circulate the information. We need to put things in action. Yeah. Creative analytic practices are unique ways of getting information out beyond articles. Well, Paula, you sound like a very resourceful person. We might need to have you on the collaborative and connecting with. Those sounds like great ideas.
And it's also getting the message to the unconverted, right? The people who don't necessarily understand the importance of fall prevention, who don't think, well, you're old, you fall, what do you expect? So I think that's also what we're looking for, is how do we sell this message to people who maybe either don't want to hear it or don't feel that it's important.
And Danielle mentioned that with the new division of LINS, I am interested to see whom falls prevention will fall to. This would be the ideal source for promotion and possibly could address the current siloed approach. Yes. And Marguerite mentions the 5th annual Fall Prevention Month starts November 1st. This is an excellent opportunity to promote the collaborative and to ask for new partners and the unconverted. And Karen mentions family physicians need lots of guidance. And working to get physicians engaged in preventative screening prior to the falls, looking at what the risk factors are and then able to send them to the correct program within their community is another suggestion. Also bring all of the working groups together under a collective impact framework. Paula, again, you need to have multiple messages tailored to those who are self-identifiers as fallers. those who do not recognize that they are at risk for falling, and those who provide various aspects of care, from allied health to education research. Yes, there's a question, will the slides be available today? I don't think it's today, but shortly, right, Mariel? Recreation and physical activity community needs to be engaged. Have an information day for all people that work with seniors. So do you mean that in terms of in each region? That would be difficult to do at a provincial level. Needing to engage and collaborate with primary care and pharmacy team to screen for risk and identify need for early prevention. Possible accreditation committees as well, as they are using whom hospitals standardized based on. Okay. So those are some good steps and suggestions for moving forward. So what I'm hearing from this conversation is that this is valuable work to be doing at the moment, and that we should keep doing so. We certainly will be, the way we connect with the collaborative is that we do a piece of work and then we report back. So for those of you, we will certainly let you know, for those of you who haven't been part of the collaborative, we'll certainly extend the distribution list to participants on this call so that you can participate moving forward and maybe be part of some of additional working group as we go along. Any other comments? I see potential engagement with the upcoming CCAPS program, which will deal with accessible design for new builds and renovation. This would be a preventative measure. I'm going to become CPAC certified so I could assist. Thank you, Karen. That is noted and will be in the chat box, so we will reach out to you for sure. Great. Any other comments? Maybe we can, before we part, we have a few other slides to share with you. Marguerite wanted to know about CCAPS. So Karen, you may want to respond to Marguerite about CCAPS program in the chat box to everybody. That would be good. I'll move on to the next step. As we talked about, we would like to disseminate the position paper. And of course, you know, we heard a few ideas that you suggested today, and we encourage you to be individuals who are active in doing so yourself. And if you have some other ideas to do that, please let us know. The working groups on data and measurement, screening and assessment tools are still going on, and they're in early stages of, I think they had both had two meetings so far, so we will certainly keep you posted on their progress. Let us know if something else should happen beyond these working groups. I have Colette, who just said that get messages to municipalities reviewing their strategic plans to commit to ensuring that the needs of older adults for suitable housing options, recreational and social opportunities, and accessible health care are met. Seniors in the community as a whole benefit when healthy aging and age-friendly features are trademarks of a community. We'll certainly keep that in mind. So these are the updates. You see the next slide is we are providing a bit of an update on the data working group. It is using the Stay on Your Feet framework to identify who is collecting what, how, why, and where it is used and what for. So that's the first stage. Once we have that collated, we will turn to you and the members of the collaborative to see what else is needed on phase 2 of this work. And there's a similarly knowledge product working group, which is using the similar framework, Stay on Your Feet, so it just made sense. And looking at the different levels of prevention, the group has started to identify what screening and assessment tools are being used across the sector. And we just want to let you know that some of you may know already there's a senior strategy. They would like to hear ideas and feedback from seniors and their families, people who care for seniors, and organizations that support seniors. So you may want to put your word in, and the deadline is for July 19th. For those of you who may not have seen that. And as we mentioned earlier, for those of you who are not familiar with the Fall Prevention Community of Practice, we encourage you to join Loop. We have an ongoing conversation at the moment on this very topic on the position paper. It was started by Sarah Orsha, and we would like to pursue this discussion beyond the webinar, and we certainly keep people informed through Loop as well. I want to let you know that Loop is free. And it is for people working and interested in fall prevention. And there's an adult side and a junior side. So, and we share many resources on Loop. And Mariel just shared the link to the Loop platform on the chat box. Any parting comments? You see, when you get the slides, you will all get the recording, the slides, and the link to and all the links that were in the chat box. You will see the references. We wanted to make sure that the references were available, especially for those of you. We encourage you to use this the slide deck if you want. Should you want to talk about the position paper in your own organization, we encourage you to use it as well. Thank you, everybody. Is there anything else? Oh, the discussion on Loop has been, the link as well has been shared by Mariel. Thank you very much. Any other parting comments? Susan and Chris, we're good?
Yeah, I want to thank everybody for their ideas and enthusiasm. It's really good to see that you think we're on the right track.
Yes, and I would agree with that too. Thank you everyone for joining us today and for sharing your thoughts. And as we move forward, thank you.
Thank you, and please stay on the line. There is an evaluation of this webinar. So thank you very much, everybody.